This lecture is going to address neuroblastoma, which is the most common type of cancer that occurs in infants. It can occur in the younger children as well, and they have a worse prognosis. This tumor originates in the embryonic neural crest cells, and it's responsible for developing the sympathetic nervous system, as well as the adrenal medulla. The most frequent area that this is detected is going to be in the abdomen, but it can present as metastatic disease as well. And when you look at the picture on the top left, you see those little pen marks. Those are marks delineating where the tumor is. And then there's a small tumor that's come to the outside of the skin on the lower picture. The right picture shows you where the adrenal glands are, and this is where the medulla, and this is where it would originate. And this is a kid who had a neuroblastoma, and obviously he is doing quite well. However, what do you notice? He is not an infant, and so his prognosis is actually going to be worse than if he had been diagnosed when he was much younger. The signs and symptoms of a neuroblastoma, once again, are going to be vague. Fevers that parents are going to mistake as just some viral illness that is much more common in kids. They may actually have a hypertension because we are affecting the adrenal gland. They can have some unusual eye rotation movements, but that's not a common finding. The abdominal mass crosses the midline, and what the parents will complain of is that it's hard to get their diaper on. They say, look at the kid like, God, you're getting so chunky. But this is a little more rapid than what would be expected, and the rest of the kid isn't gaining any weight. That's one of the flags that the parents will come in, but they're still not bringing them in when this tumor is small. It's going to be big, and then when they think back is when they recognize, I noticed that when I put that kid's diaper on, that it was getting tighter and tighter and tighter. Because it's an abdominal mass, the child may experience constipation, may also have diarrhea, and they don't have much of an appetite. If it's lower in the abdomen, it's going to affect the urinary outlet, and then they're going to have difficult time passing urine. If it's affecting the lungs, then the child will have respiratory distress. We'll do the typical imaging studies, the PET scans, the CT scans, but because it's affecting the adrenal glands, we're going to send off the catecholamines, the VMA, the HVA. These are both urine samples. So it's a 24-hour urine sample. You should be very well schooled on how to do a 24-hour sample. They can also do an MIBG, something relatively new, and the neuroblastoma takes up this contrast in a very low level, but it'll outline the tumor. So the treatment for a neuroblastoma is to surgically resect it, stage it, and then begin chemotherapy and radiation therapy. Only the advanced stages would be candidates to have bone marrow transplant or stem cell transplant. And this ends neuroblastoma.